I think the first thing I ask them is, how much patient contact do you want to have? Because that really can separate. And then once you kind of know that, then you start to look at all of the different pathways that are within that, that section there. I also think they really need to understand the roles and responsibilities. So the difference between what I want to do with what you actually are going to do in the role. Not every role is as progressive as others, not every state. So you really have to understand what you want to do and then understand what you need to be successful now, but also what is coming up in the future. So we have to maybe look at pharmacy as like a research and development, right? An R&D.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. Welcome to the PQS podcast, where we focus on medication use, quality improvement, and how we can utilize pharmacists to improve patient health outcomes. I'm your host, Nick Dorich. Now, I do have with me, if you are watching on YouTube here, a special guest for today, and that is Christine Perry, Manager, Pharmacy Recruiting and College Relations with Albertsons. Christine, how are you today? How's it going?
I'm good, Nick. It's so wonderful to see you, and I really appreciate this invite and opportunity to come and chat with you today.
Excellent. Well, for folks, if you don't know Christine, we're going to give a little bit of background. Christine, you and I have known each other for perhaps longer than either one of us wants to admit. We'll keep that to just us. We're not going to air out our laundry here. But Christine, can you give us a background on, what is your background and experience in pharmacy and in healthcare, and then how that relates to what it is that you do today at Albertsons?
Absolutely. So I graduated from the Massachusetts College of Pharmacy, and I am a proud community pharmacist. I went to pharmacy school wanting to be in community practice and left wanting to be in community practice. So that really is my specialty. I started working for my company at the age of 16, which is what actually inspired me to be a pharmacist after talking to my pharmacist and finding out what they did all day. And then I had my path set. So I have now been with my company. I celebrated my 40th anniversary this year. Can you believe it? I spent a lot of money at Sephora on some anti-aging cream, but so I'm in a different role, but with the same company. So over the years, I obviously worked as an intern in the greater Boston area, then graduated, went right into practice, and then moved up and went into our office doing operations. At that time, my focus was on scheduling and recruiting and training. Then eventually I moved up to a corporate position, which is doing recruiting full time. And I've been in this position now for almost close to 20 years. So I really do love it. And I think the piece that I love the most is being the one that opens the door for great pharmacists to join our company. And then I really get to watch them shine and do, great things in their career. So I have a sense of pride, sort of like a pharmacy mom, in what they do and watching them over the years.
Yeah, absolutely. And Christine, that kind of aspect of being a pharmacy mom and mentor, a guiding light. Certainly that was how you and I had originally met. And you and I typically get a chance at least once a year to catch up at the APHA annual meeting. And the conversation that we're going to have today is actually kind of dovetailing off of a conversation you and I had at this year's 2024 APHA meeting, and talking about, how we prepare pharmacists, because graduating from pharmacy school, it is different than practicing, once you're on the bench, especially in a changing healthcare environment. So what our conversation today is going to focus on is really, hey, how do you go from that somewhat theoretical or from that curriculum to what you need to learn when you're doing it, real for for the real experience and being hands-on with pharmacy practice and experience. And I think really from just my own conversations with various people that have been involved with this industry, you have been on both sides of this, on the bench, but now also in kind of that corporate setting, making sure that people can transition. So we're going to hope to provide everybody with a little bit of considerations. How do you effectively transition? What are the non-book lessons that you need to make sure you have or that you learn and develop and becoming a pharmacist? And hopefully we'll have some other interesting tidbits that keep people really excited for this industry going forward. So Christine, with that as our background, are you ready to begin for today's conversation?
Absolutely.
All right. Well, Christine, first question I have for you. Let's dive right into it. Pharmacy school curriculum, it provides us with a lot of information and a lot of knowledge. It's a lot of time spent on pharmacotherapy and book application or being able to really apply that, really understanding the knowledge. But how we apply that knowledge is what makes for a good pharmacist, not just a good pharmacist, but a great pharmacist. So from your own standpoint, when it comes to students, residents, fellows, and new pharmacists, are there any, important skills, maybe things that you didn't learn in pharmacy school that are imperative to becoming a successful pharmacist as you start or as you continue throughout the course of your career?
Absolutely. So I'll break them down into two areas, what I think is really clinically focused for us, and then another area of more of a professional success. So the first thing is certifications. I think this is really a growing area of pharmacy. Most students graduate with just their APHA immunization certificate. There's a few schools that are now adding on MTM or diabetes, but not all. And I do think that's sort of the new trifecta. You do have to graduate with those certifications, so I encourage College of Pharmacy faculty, the accreditation bodies to really look at that and adding that in, because that is what today's pharmacist needs on day one to go out and impact patients, but also look at different payment models and certification and collaborative practice and things there. So I think certifications is the big thing that we're looking at. And then also looking at BPS, right? So officially board certifications, whether that is in nuclear pharmacy, psychiatric pharmacy, ambulatory care, there's a whole bunch to choose from. And I think that's another area that's continued to grow. That's certainly not an entry level right at graduation, but I think people really looking at where they'd like to specialize, where they'd like their expertise. I think those are probably the two areas that are really our gold standards, is different certifications and BPS. I also think that different certificate programs, things that are going to allow us to advance the practice, prescribe, like hormonal contraception, epinephrine prescribing, PrEP and PEP, Doxy PrEP. I think that's the next level of certificate programs. And I think colleges of pharmacy should also look at what their state is providing now for pharmacist authority and what's coming up in the next few years. And again, try and find ways to add that into the curriculum or allow it as maybe another class that they would be able to take and add that in. Another area that pharmacists can look at is micro certifications. And if you don't know what that is, those are short competency-based courses that are really going to help to build our skill level. And that transition into the other skills that pharmacists need, which would be around leadership and interpersonal skills. So micro certifications can help you achieve that. They can be things such as communication, leadership. I also think financials and a business acumen is important for any pharmacist to have. The payers control the market, and we have to get in the game and understand how things work, and then how that impacts our profession, how that impacts our patients. So financials are good for every pharmacist to know on the business end. Other areas of leadership and interpersonal skills would be problem solving, critical thinking, resilience. I think DEI is extremely important to know. And then the last thing would be bilingual skills. So a Spanish-speaking pharmacist, a pharmacist that may be trilingual, is very valuable to be able to serve the patients in their community. So that would be, I think, the group of areas of looking at both your clinical focus of what we have to do as practitioners, but other areas where we can really strengthen ourselves to be drivers in our profession.
Thanks, Christine. So a couple items I want to hit on before we go on to the next part. And you mentioned 3 certificates as that trifecta. Immunizations, which are most schools and colleges are offering, but I think MTM and diabetes, were those the other 2 that you mentioned or that you grouped with it?
Yeah, so I think those are the other gold standard certificate courses that are out there right now. There's some HIV courses. There's obviously some vet courses that are out there and different things, but I think those that are universal in every state, that every pharmacist, that would be the new, I think, trifecta of the gold standard that each pharmacist should expect to have, either as they enter practice or very shortly thereafter.
Great. And I think this is an important point for us to talk about, because when we graduate or when we get that PharmD, or even as we're going through a program, we know as pharmacists that continuing education is part of the program. And it's not just getting the CE hours, but medicine and healthcare, they change. both in terms of what we know, treatments that are available, understanding the disease state. And one of my big recommendations when I work with young pharmacists or graduating pharmacist students becoming pharmacists is it becomes really important for you in your career. Do you want to be do you want to generalize and being able to approach anything and everything? And that's where, Christine, to your point, immunizations, MTM, diabetes, those are all very common. That's going to be there in every single community. And that's a skill set, a mindset where it can transfer, really wherever you're going to be versus if you do want to go in something more specialized like HIV, that may be harder to get into and there may be limited opportunities, but there does come to some degree a higher degree of perhaps job satisfaction. Or being able to have or more specialized, job that could be perhaps more insulated in the job market as well. But really, that's always one of my biggest pieces for younger pharmacists or newer pharmacists is either you got to figure out early, generalist, or do you want to be specific and taking that approach to it. I do also really appreciate your call out here for being able to understand to some degree the economics of the pharmacy business. That becomes increasingly important as we're working with pharmacies today. And then the other aspect that you talked about, whether it's DEI, population, working in the community, when we go to pharmacy school, it may be somewhere close by to where we grew up. It may be somewhere, that's a city that we wanted to go to, or hey, maybe it's where our parents went to school. We want to go there. But where you get your first job, especially if you're doing a residency or fellowship program, you may be going somewhere where you're uncomfortable and it's maybe not your first choice. So that kind of flexibility to be able to work with, because ultimately the community that we're in, those are the people that we're working with. So being able to provide them that healthcare knowledge is going to be absolutely key for what we do going forward. So Christine, with that, let's talk about a little bit further. For someone that is entering the pharmacy profession, either as a pharmacist or a technician, what's your advice to them? What's our current state of pharmacy, and what are going to be the things that are most important for them so that they're successful in this endeavor in the pharmacy profession, but also so that the profession, continues to not just survive but also thrive as we go forward. What advice would you offer?
Yeah, Nick, great question. So I do a lot of mentoring and precepting as you do. And often the most difficult question, which would seem to be the easiest, is right. What do you want to do when you grow up, right? What do you want to do with your life? And it is so difficult for students, right, or new grads to kind of answer that question. So I take them through, a series of a few questions to see. And I think the first thing I ask them is, how much patient contact do you want to have? Because that really can separate. And then once you kind of know that, then you start to look at all of the different pathways that are within that, that section there. I also think they really need to understand the roles and responsibilities. So the difference between what I want to do with what you actually are going to do in the role. Not every role is as progressive as others, not every state. So you really have to understand what you want to do and then understand what you need to be successful now, but also what is coming up in the future. So we have to maybe look at pharmacy under like a research and development, right? And R&D. What's in the pipeline? What's coming up? What do I need to do now? And what do I need to do in the next 5 years to stay up to date in what my area is? I think you also understand what the scope of practice is and what you'd like to do. I mean, like I said earlier, I've always wanted to be a community pharmacist. That's my space. I celebrate it. I'm an expert in that space. And what do I need to do to be at the top of my game to take care of patients? I also think it's important that we all remember that we have a pharmacist in charge role. And I think a lot of us are thinking that we're a clinician and we want to stay in that space. When I talk about really understanding the roles and responsibilities, every one of us has to put on a pharmacist in charge hat. We may not be the pharmacy director, the pharmacy manager, but we are going to be the pharmacist in charge. And what does that mean? What comes with that in regards to what we have to do to lead and manage our team, our patients, the facility that we're in? So again, the leadership piece is really important, but we can't ignore the fact that we are in a leadership role and we're in a area where we have to make the call. You have to be in charge. So it's not just clinically focused. There is more there. So I think also understanding that and celebrating it and walking into that. And then Pharmacy is more, again, than just the clinical. There's the business side, there's the operational side. And even if you, again, don't officially want to move in there, you want to stay very close to the patient. I think you have to understand those roles and responsibilities, how you fit in with that, how you work there as a team, and again, how just the whole system works. So I think it's important to make sure that you're aware of that and have some knowledge to be successful. And then when it comes to technicians, I think, right? So technicians, I would really like to remind them that this is not just a job. For techs, it's a career. And I think that's really exciting. People can get benefits, they can support their family, they can make a good salary. They are a valued member of the healthcare team. I think if you ask any pharmacist, right, they'd give their right arm for their technicians, their team there, right? A lot of them are like, I'm giving up my cost of living increase, my raise, give it to my team, give it to my staff. And then what's also really exciting for technicians, there's a lot of expansion in their scope of practice. A lot of technicians are being trained to do vaccines. A lot of technicians are working on adherence and helping with the gap there. So they are, again, a very valuable member of our team and play an important role.
Yeah, I'm gonna hop right onto that note about technicians. And Christine, I was at a trade show this summer with independent pharmacies, but had one pharmacy owner that was talking with us about, hey, we're not able to do some of the things that I wanted to do for our business because he had a lead technician that left and was no longer at his pharmacy, and they were trying to do as much as they can, but the technicians are the lifeblood of the pharmacy. We think of pharmacy and it's what we do for patients. And yes, that is there and that part is always there. But at the same time, you need to make sure that the wheels are always turning. And you're going to have a pharmacist or a pharmacist on staff, but for every pharmacist you're having, or you need to have, how many technicians there supporting and handling administrative items, handling billing, prescription intake, doing all of those things and being able to triage effectively. Hey, a patient's coming to the counter. Is it the transaction versus, hey, do we need to have them speak with the pharmacist or go out in front of the OTC aisle and help have a pharmacist help the patient select, the right cough and cold medicine, which is very pertinent now, for myself, having just getting over an illness, right? Those are all essential aspects to having pharmacy technicians. As you said, Christine, I think there's a lot of us in this profession that do absolutely view it as a career pathway and that we want that to really expand more for those members of our team. Christine, the other item where you started off talking about this and thinking about, well, hey, what are you going to do in your career? It had me thinking a lot of, it's almost like kids playing soccer, right? Like I'm talking small 5-year-olds when they play soccer, where it's just kind of chasing after the ball. It's not playing the game so much, right? It could be very easy for someone to graduate pharmacy school and, hey, I'm doing the job, I'm going to do the thing. What you're suggesting is that we need to be playing, in this metaphor, we need to be playing a more mature form of soccer, not just following the ball, but thinking ahead. What is it that you want to do and what career path best suits you to take on that sort of role, both for your own development, where you're living, how you want to work, and going through for some of those aspects. So does that metaphor resonate with you here for the description?
Yeah, absolutely. And I often will ask students, like, really follow your heart. I was talking to a student a little bit earlier this week, and he had a lot of people in his head. He had his preceptors at his current API rotation. And it was he was, I think, trying to please and take that all. And I was like, what do you love to do? What do you really like? And when I really asked that question, he was able to tell me, but there was always still the but, because he had so many other people. I said, you need to really follow your heart. You need to look right deep inside and get the noise out and focus on what you're really passionate about. And then that's the key. Doesn't matter what someone else would like you to do, but if you're not interested in oncology, that's not the pathway or the setting for you. Right. And if you're really interested in ambulatory care, then that's the great setting for you. So you've got to kind of find what makes you happy, where you really be successful. And right, as they say, right, you'll enjoy going into your job and making a difference every day.
Yeah. So Christine, moving to our next question, and a lot of our conversation, and even when you and I talked about 6 months ago with this theory in mind, it comes down to what I would boil it down to. It's the necessity for us in the pharmacy profession to have a growth mindset. How do we expand what we do, and how are we able to be flexible taking that clinical knowledge, but expanding to the services we provide and working with patients. As you've spoken about it, Christine, it's, hey, how do you grow in a way that's going to be most satisfying, most content for you as an individual? How do you go and work into a practice setting, and even items that you brought up, business considerations? So, when it comes to developing and honing that growth mindset, how important to that is that for new pharmacists? And are there ways that you would recommend that folks can cultivate that as they go throughout their career?
Yeah, I think if you're going to enter a career in healthcare, there are going to be medical advancements, right? New ways to take care of patients, new medications that are coming in the future. So that is part of the profession that we have decided to do in being in healthcare. I try and take a tiered approach as I continue to learn. The first thing I look at is to make sure that I'm staying on top of the areas where I have expertise. So for me, I have focused on my CEs this year on vaccines and the GLP-1s, right? That's what's hot in direct patient care. That's what they're concerned about. So I want to make sure as an expert in those areas that I'm completely at the top of what the new standards are. Then I try and approach areas where I need some development on, or I need to refresh. So again, for me this year, I did a CE on cannabis. So I'm up to date on that and make sure that I'm actually asking those questions of patients who are coming in, right? Because I got to understand the toxicology there, and right goes into that. And then I think a lot of patients I've been seeing with Crohn's, IBS, and rheumatology. So I needed to refresh there. So I've been trying to focus some additional Cs. And then the last thing I would encourage all of your listeners to do is not to forget professional development. Again, back to that leadership there. So this year I did a C on new areas to precept, right? So now I'm right. I'm a grandmother, right? I'm another generation. What is happening in today's colleges? What are the new things there as I am precepting and working with students? What are some of the new ways to approach them? What do I need to know? So I did one of those Cs. So I think that your listeners or pharmacists in general, right, is looking at different options of ways that you can stay up to date and continue to grow in your profession. There's obviously CE programs, right? We're required to do that and get that done for the board. I think there's also a lot of virtual events, a lot of Zoom events that you can go on through many pharmacy associations. Our colleges of pharmacy have speakers. I think I've always enjoyed doing those and got so much out of it. There's also TED Talks. I've done a lot of DEI education in doing some TED Talks, and those are some things that I've looked at recently. There's LinkedIn Learnings. I really like those, and I've done a lot of them there. I've even done some certificate courses through LinkedIn, and I think, again, experts in the field, they bring them onto their site, and you're able to learn and take it, and you can do it on your own time, what works for you, in between our very busy schedule. So there's a lot of ways where you can get full clinical development, but also other ways that are going to build your professional skills and ways for you to impact the people around you, better ways to approach patients or work with your team. So I think all of those you have to weigh them all equally and put in the time to develop yourself overall.
It's funny you mentioned the LinkedIn Learning. I've got a prioritized list of about 10 courses that I want to try to go through over the course of, hey, the next few months. And part of it, Christine, is, hey, I'm going to watch football on Sundays. Well, maybe I can spend at least an hour before 1 p.m. kickoff, to go through. And if I'm going to sit down for 3 hours to watch a game and enjoy it, I got to make sure I'm working out my brain first. It's that little reward or incentive to have that part covered. So any little way we can chip away at that is great. Now,
Absolutely.
Christine, before we finalize here and wrap up, I do want to ask you kind of one bonus question. And this was also an item that you and I discussed, months ago, and thinking about, hey, the pharmacy profession. And particularly, we've seen it. You certainly see it from the standpoint of, you work for a group that is a large employer of many pharmacies. We see it just from online discourse as it relates to pharmacy, is that, it is a stressful job right now, especially on the front lines. For a variety of reasons, it is a profession that is been kind of under attack from a lot of different ways, and that can lend itself to some degree of a negativity spiral. But part of the conversation that you and I had months ago was that, yes, there are challenges, and some of them are new challenges, and some of them are pretty severe. However, we can't lose sight of the positive and the opportunity that is presented for pharmacy as we go forward, and that we need to be able to not disregard or ignore negatives, but we keeping them in mind. But we do need to positively attack these new opportunities going forward. So with that in mind, is there, and I'm sure there are lots of things, but is there one thing about the future of pharmacy that you are most excited about as you look into your crystal ball, and as you talk with new practitioners or students that are going to be soon become our fellow practicing pharmacists?
Yeah, so I think the scope of practice that we are seeing right now and our ability to become prescribers, do more things around test to treat. I think that is what's most exciting. I spent most of my career in a more of dispensing role and as a vaccinator. I think today's practitioner is really going to spend their time as a vaccinator and as a prescriber. And I think that's what's most exciting for me. In Massachusetts, we got approval this year to do hormonal contraception prescribing. So that's actually the next course that I'm going to be taking. So me myself can be certified in that and be able to provide those type of services. So I think when those things open up in your state, I think we have to really run towards it and take the opportunity to become a specialist there. And we also have to advocate. So I think that would be the second thing, right? Is once we have that certification, we must advocate, because patients really do not know the scope of what a pharmacist can do, how we can help them. We all know this, this information. We're often the healthcare practitioner that is in their community. We're certainly the most accessible, especially for our community-based practitioners. So we do have to advocate and let them know that this is not just a place where they're getting their medications, but it's a place where they can also get more services. So we've seen through the pandemic what happens when we really, I think, overrun the hospitals. And I think hospitals are going back to not treating everything, but maybe focusing on critical care. So we've seen a shift in a lot of the acute care moving back into the community, whether that is walk-ins or that's in your community pharmacy or different type of in-store clinics. So pharmacists really are able to impact that. It's not just vaccines, but there's other services that we're going to be able to help patients with and take care of them from more of an acute perspective. So that's what really has me excited right now. And I am seeking out all of those different opportunities.
That's great, Christine, and thank you. I personally really look forward to that as an opportunity for pharmacy. I know when I went into pharmacy school, I went into pharmacy school much like yourself, as a high school student who was, hey, I get to help patients and talk with them about their medications. I get to talk to people all day and help them with their healthcare. That's why I went into pharmacy. And certainly I didn't know anybody in pharmacy per se at that point in time. I thought it was just the medication dispensing, but I became enamored with these are all the potential opportunities for pharmacy. And I think you and I and others know that that's been a little bit slower going than we would hope
Right.
and expect, but it is a work in progress. And as these opportunities come up, we do need to seize the opportunity. Christine, with that, and as we wrap up here, I do want to give you kind of just one final opportunity to just provide a message to your fellow pharmacists and to those in the profession, especially right now at the time that we're recording. It's the start of flu shot season, or the start of flu season even. But this is a time right now where, as we go forward, there's a lot of opportunity for pharmacy. So do you have any, well wishes, words of encouragement, or just other, points of advice that you would provide for our fellow, pharmacists and pharmacy technicians?
So working in healthcare, I like to think only the strong survive, per se, right? And you have to have a real passion for it, because we're, especially those of us that are direct patient facing and work with the public, it's a challenging area, whether you are in nursing, you're in medical, you're in pharmacy. So that's the setting that I've chosen. And I always will reflect back on the positive. And I know that if I wasn't there that day, right? Or I know by being there, the difference that I make. So I go home at the end of the day, not that anybody had to tell me I did a good job. I know I made a difference, right? And I know, I think 4 days of clinics next week, I'm going to be out at vaccine clinics. So it's going to be 12-hour days. And I'm thrilled to be there, because I know I'm going to be saving lives. I know I'm going to be protecting them. I'm going to be protecting their family, protecting their community. I'm going to have students there that never have given a vaccine. They've just completed their training, right? So we're going to walk them through, and by the end of the day, they are going to be an expert in providing vaccines and really be able to take care of the patients. So it's something thrilling. And I think we always have to remember that even when the long days, you know that you are really making a difference. And I think that's where I'm passionate about the profession. 40 plus years later, right? Loving what I do, loving the impact that I can make. And even though my name is most likely going to be called out about 1,000 times in a day, I know that I'm helping my team, I'm making a difference, and completely across the board. So yeah, it'll be tiring at the end of the day, but I'm really professionally satisfied in what I'm doing.
Yeah, I love to hear that message, Christine. And I think that's where a lot of us in this pharmacy profession, whether it's pharmacists or pharmacy technicians as well, we're all part of the team that's there. And we already had talked about how it's necessary for all of us to be on that same beat. But there is a great road ahead for pharmacy. And I know I'm looking forward to it. Appreciate you sharing your thoughts here to highlight the things that get you most excited about this. And we're looking forward to a lot of great things to happen in this pharmacy profession so that we can keep, as you said, we can keep helping people, we can keep saving people, and that for us in this pharmacy profession, that we're maintaining our professional satisfaction, contentness, and doing great things here. Christine, with that does mean we have wrapped up today's interview, and I thank you immensely for taking some time out of your day to share, these recommendations, this positivity, and your just experience and look ahead into the world of pharmacy. Before we go, if folks want to reach out to you, if they want to connect with you, is there a way that they can contact you? And then anything else you would just like to note here before we wrap up?
Sure, absolutely. So I would welcome any of your listeners to connect with me on LinkedIn, Christine Perry, RPH. And I do a lot of professional development. I do career development, a lot of interviewing skills on my site. So I welcome anybody to follow with me, connect there, send me a DM. If there's any questions that they have, I'd love to reach out and work with them.
Yeah, as someone who's personally taken courses with Christine as it relates to professional development, residency, interview prep, all those kind of things like that, I can give it my 10 out of 10 recommendation as well. So from that aspect. So Christine, thank you again very much for joining us today. Thank you for all your contributions to pharmacy and developing our past, current, and future leaders in this profession so we can continue serving patients. But for our audience, that does mean we have now wrapped up today's episode. So we do thank you for joining us. We hope you listen to our next episode of the Quality Corner Show. And before we go, we have one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.